radiation protection. Professor Frush is also co-chairing in the International Society of Radiology Quality and Safety Alliance, ISR-QSA, which I am a proud member of. In addition to his leading role in pediatric imaging, he is the leading the Duke Medical Physics graduate program. Go ahead, Don.
Well, thank you for that kind introduction. And it's a real honor to share the stage here with so many of today's leaders. And it's really a privilege to share the stage with you all. You know, the in-person ability to generate ideas and to move on with medicine is outstanding. And I know that this event will only accelerate over the next few days. While I have some committee appointments and organizational responsibilities, I'm here on behalf of children. And I'd like to make 2 points here. And just take a minute to look at this. We all have children, we have grandchildren, or we were once children. So it's relevant to us all. This is the essential patient population. It is the essential patient population because this is our future. And so it's very important, while it's a relative minority in what we do every day, that we pay special attention to this population. And over the next few minutes, I'll outline some of the things that we have done as organizations to move in that direction, as well as talk about some of the communication needs we have. And the second point, besides the importance of children in general, are, and I've listed many things here that sort of typify why pediatric imaging is unique compared with adult imaging. Things I think you realize, you know, different sizes, different physiology, different diseases, different radiation sensitivities. Many things are different. But there's one fundamental difference here. And while we are stewards of our children as parents, as grandparents, and so on, we are stewards also as medical providers. But one of the difficulties in dealing with children is that the parents are the decision makers. It's not the patient that makes this decision about imaging and about whether this is important and about radiation and so on. So it is a much more complex situation because you have really 2 individuals that you're dealing with. So we have stewardship towards our patients, but we also have to realize, and I'll talk about this in a minute, that important dynamic in communicating with the parents about what is important here. And pediatric imaging has played a historically very important role in what we do in terms of imaging. This is one of the first clinical applications of imaging in the United States, and this patient broke his arm. I'm not sure that I would be able to say that from this image, but that was the decision from this. So we have been involved for very many years. This was 1896. And I won't go into detail, but these are sort of the icons that come to mind when we talk about medical radiation and some of the consequences that parents and grandparents feel in terms of the psychological impact. That gets back to the stewardship idea here. So I'll talk about 2 different fundamental approaches to imaging in children, sort of what we should say, some of the advances, some of the work that's been done in scientific circles, some of the needs here, as well as how to say these things. And it'll become more clear in just a minute here. So let's begin with just sort of a brief review of what should we say. What is the content? What are the kinds of things, the actions that we're doing to this end here? So the first thing is we do need better numbers. And this was some information from the NCRP review a few years ago that showed when comparing pediatric imaging to adult imaging that actually, as to be expected, that the total dose to the U.S. population from children is much less. But if you look at the kind of imaging that is done, CT accounts for much more of the patient dose than CT does in the adult population. So that's something we need to understand. We have to have a better feel for diagnostic reference levels, and I know there's been some work done in Egypt with those, some sentinel work seminal work with this approach. Diagnostic reference levels are important. Cumulative radiation dose in children. This is something that is becoming front and center in terms of, are we imaging too much? Are there patient populations that are really exposed? And I would just say it's not as well studied in children, probably not as applicable. We tend to use more non-ionizing radiation modalities in children, but it is something that we need to be accountable for. Technologic advances, photon counting CT, basically a technology that allows us to look at the energies of individual photons versus what is more conventional now. And I just put these up. It's a complex cardiac case, but you can see the image to the right there is photon counting CT, less dose, less contrast, improved contrast to noise ratios. But we still have to learn how to use this in the pediatric population. So technologic assessment. We have some advancements too that are opportunities from the scientific realm. For example, we know that we can add noise to pediatric CT examinations. The problem with children is you can't expose them at serial low doses. It's just ethically not something you can do. So what we can do is take a CT image, we can add noise to it, and now we can actually add lesions to it. You can see real and simulated lesions are very close. So you can basically take a normal CT examination, add a lesion to this, and then reduce the dose and look for diagnostic accuracy here. Continuing on with the content of what we need to talk about in this dialogue of radiation protection for children is we need to go beyond diagnostic reference levels with dose only. We need to be able to look at image quality, and this image quality has to be assessed in a automated way. It can't be observer type studies. And here's some work we've done at Duke looking at global noise, global spatial resolution. So fundamentally, you can put a CT scan through this process and get a number that represents these. And then you can have two things. You can have a dose reference level, and you can also have a noise reference level, and together these kinds of things provide optimal performance evaluation for children. So we need to move on with the quality spectrum here. And while I've talked about some of the advances in terms of studying dose in children, being accountable for what we do, having better numbers, just don't forget the basics. You don't want to do a CT scan when someone has had barium. And some of these fundamental things, I think, are lost in some of this dialogue about some of the technological advances. So don't forget the basics here. Now, we talked a little bit about what to say, the kinds of things for the science of dose reduction, but how to say it is really important. And I think this gets at this issue of stewardship that I talk about, and the mother here looking at the child saying, what's wrong? Why are you in the control area? No, you've not been back there before. The child is sedated. There's all sorts of angst and anxiety that this mother feels during this examination because, again, she is responsible for the care of that children. So you need to realize that when we talk about conversations, when we talk about dialogues, how to say things. And these are three important points that I have found very successful in terms of dialogues. And that is to be informed, know what you're talking about, be sensitive, understand what that caregiver wants to know, and be engaging. And these points, irrespective of what you're talking about, I think have been very successful in terms of effective communication. This is some of the fundamentals of the Image Gently Alliance here, the kinds of things that we have promoted here, and I just listed these kinds of things. And I think these are globally relevant. This is a dialogue that I think is shared by many of the current alliances that exist across the world these days, as are under the umbrella of the ISR Quality and Safety Alliance here, and you can see that this is a shared responsibility for these organizations, and the Quality and Safety Alliance has a number of actions, efforts it has done. I just listed here the call for action with respect to radiation reduction for all patients. And when we're talking about how to talk to individuals what to say, how to say it. We have to remember that that has to be something that is geared to the individual that we're talking about. And I just put this up here as an illustration that many of the websites that deal with information related to radiation protection and education are at a much higher level than are geared to the patient. So we have to be mindful that we talk the language of the individuals that we're speaking to. And finally, with respect to this sort of communication issues, we need to begin to teach this at earlier levels than we're doing. And that includes in medical schools and even in universities. And this is a project that is going to be released within the next few weeks from Image Gently, which is geared to medical students, that talks about radiation protection, but under the framework of many other important things in medicine, such as shared decision-making, appropriateness criteria, etc. And in the end, although we're talking about radiation protection, we talk about risk, we talk about all the things we're doing to improve the technology, to improve our understanding of radiation, and to improve the communication of this with the patients and providers. We have to remember that what is front and center of what we do every day, is that CT, is that imaging saves lives. And I've just put this slide up here. I wish all of our CTs came up with little circles around it, but this is a young man involved in an accident, and I'll just put this up here. He was on this motorcycle, and this is what he did to this truck. Now, fortunately, he was wearing a helmet. He's got a little bit of orthopedic stuff right now, but he's alive. And there's active extravasation from 3 of his extremities, including in that on the upper image on the right, free intraperitoneal bleeding. And the surgeon sitting next to me said, this CT scan saved this young man's life, because otherwise they would have gone for orthopedic and vascular reconstruction type surgeries. And you all know this happens every day, so do not lose sight of the fact that what we do is incredibly valuable, and that needs to precede any conversation that you have with respect to risk here. So again, I just appreciate the time to talk to you a little bit about the importance of children, about the kinds of things that are being done for radiation protection, some of the science, and the importance of saying these things in the appropriate way, and the organizations involved. And I understand that there's an Egyptian Society of Pediatric Radiology that is forming and advancing here, and these are the kinds of efforts that will go a long way. So listen to these little voices, and together we can do big things with those. Thank you.
Thank you, Professor Don.